airway pressure. So you have a mask, usually begins with something called CPAP, which is continuous positive airway pressure. And it is a very, very hard therapy to get used to. It takes several months and a lot of time working with the oxygen companies to find the right mask that fits to your face. Because what this machine does is it blows in pressure, because it's been designed for treatment of obstructive sleep apnea, where you have a narrowed airway. So it blows in this air at pressures that you can set from anywhere of 5 centimeters of water to 15 centimeters of water to keep that airway open to deliver the oxygen. But my problem is, I'm not seeing obstructive sleep apnea. These aren't people who are snoring. They're not obstructing their airways. They're just not breathing because of the altitude. So I didn't want to do the sleep study. So I said, let's come up with another way. So this is what we're doing in our cardiology department. If someone comes in to see me that I think is high risk for sleep apnea, we measure your oxygen levels. We have you wear something called a pulse oximeter overnight, that there are oxygen companies that deliver to your house. We get that back. If it's abnormal, meaning like the ones that I saw earlier with the desaturations, I say, let's put you on some oxygen at night. 2 liters, like you see in the hospital, the little prongs. We repeat it again, look at it. If it's still abnormal, sometimes we'll increase it up to 4 liters a minute, and then repeat it. But if it's abnormal at that point, then it's hard for me to believe that we're just dealing with hypoxia, which is triggering this. Because there's no way at 4 liters you should be getting hypoxic. And at that point, I become concerned about you having some type of coexisting obstructive event. And we'll send you for the formal sleep study.